everyone. Welcome to the Sound Health Network's webinar series. I'm Indre Viscontas, the Director of Communications. The Sound Health Network is an initiative of the National Endowment for the Arts in partnership with the University of California at San Francisco, and in collaboration with the National Institutes of Health, the John F. Kennedy Center for the Performing Arts, and Renee Fleming. It is my great pleasure today to welcome you to this exciting panel on exploring app-based music interventions and therapist-led music therapy. This particular panel was the brainchild of Dr. Asal Habibi, who's an associate professor of research and psychology at the University of Southern California. Welcome, Asal. So great to have you here. And I just want to let you know who the rest of our panelists are as they come online too. So Dr. Melita Belgrave is an associate professor of music therapy at Arizona State. Dr. Edward Large is a professor at the University of Connecticut and also the founder and chief science officer of Acilo Biosciences. Dr. Frank Russo is a professor at Toronto Metropolitan University and the chief science officer at Lucid. And Dr. Matthew Sachs is an associate research scientist at Columbia University and also works for Spotify. Welcome, all of you. I will let Asal take it away now and give us an overview of why we're doing this panel.
Wonderful. Thank you, Indra, and hello, everyone. Wonderful to be here. And thanks to the Sound Health Network for hosting this discussion. As you mentioned, I'm a faculty of psychology at University of Southern California. And before I tell you more about the panel, I just quickly want to share a disclaimer that currently I'm a PI of one of the music-based intervention apps that we're going to be talking about today, Lucid. We're running a clinical trial with Lucid at USC at my lab.
Oh, I guess I should jump in and say I'm also involved with a company called Rubato that uses personalized physiological responses to music to develop personalized playlists. So I guess we all have a finger on the pulse.
The pulse. Great, thank you. So really today's goal is to explore the evolving landscape of music-based interventions with a particular emphasis on intersection of technology and traditional methods of therapist-led sessions. We know that the technology is developing and we are having the luxury to be able to access personalized music across kind of like broader demographics and in more areas that are usually not accessible, maybe just one-to-one personal music therapist. And we know that there is really different apps that provide traditional methods of listening to a playlist that is for focus or relaxation, but also really this technology has advanced to use AI to be able to use kind of mental and emotional states to suggest music and personalize music. We also are all recognizing that the role of a music therapist, the human interaction, the empathy that comes to music sessions, and how things can be adjusted to the patient and client at a time when we have a human therapist who has experience and expertise involved. So really today, I wanted to have a discussion and all of us to talk about the avenues that these two can interact, can coexist, one not replacing the other, but complement each other. So I really am excited to have all of you here to talk about your expertise, and then we can take the discussion from there. So let me start by using the questions to also have our panelists to introduce themselves a little bit and tell you about the specific work that they're doing. I'm going to start with Frank. So Frank, you are the Chief Science Officer for Lucid, which is an AI-driven music-based intervention app. Can you tell us a little bit about Lucid, the work that's been done, but also maybe just kind of with the emphasis of how Lucid is addressing the need for accessibility of these interventions, for example, thinking about underserved communities or more remote areas. If you can unmute yourself.
So thank you for that, Asal. Very broadly speaking, Lucid is trying to turn music into medicine. Our approach is to marry together insights from music therapy, music science, with the power of AI to curate personalized interventions. That's the general approach. Our primary focus has been on anxiety and comorbid disorders. So conditions like agitation and dementia, tinnitus, pain are in our sights. My role has been to coordinate studies with partners. I also work closely with the development team to develop new evidence-based modalities. My view on what this is all about, like what is the utility here, how does it fit with music therapy, goes something like this. If we take the US, I think we're currently at a little over 330 million people. 31% of those people are likely experiencing anxiety at some point in their lives. So a conservative estimate would be that 100 million people may benefit from music therapy. We know that music therapy can mitigate anxiety and related problems. I looked it up, and it seems that there are currently about 25,000 music therapists. If we double, if we triple, if we quadruple the number of music therapists, we won't meet the demand. There are some people who are just not comfortable seeing a therapist. And one way to think about these interventions is that they're a gateway. Maybe gateway is being used the wrong way here, but it's a comfortable way into taking care of yourself and thinking about your issues. Some people are, of course, living in remote locations where a music therapist is not available. And more broadly, you already touched on it, Asal, but I think that there's a real opportunity for music-based digital therapeutics to complement the good work that music therapists are doing with their clients.
Great.
Thanks, Frank. Yeah, that's really great to put us into that context of what the need is and how, yes, music therapists alone probably can't meet this need unless we start turning them out in much, much, much larger numbers. I do want to mention to those of you that are with us live on this webinar, we deliberately chose to record this with you in mind as an audience so that you can ask questions. So if you're listening live, please feel free to write your questions in the Q&A section or in the chat. And I'll be monitoring those and bring them up to the fore as we go. But Matt, you're a research scientist at Spotify. Spotify is sort of built an entire company around personalizing music and suggesting music for different purposes and uses. So tell us about what you do at Spotify and how you approach this idea of personalization at this company-wide level.
Sure, and thank you all for having me. So I'm currently a data scientist in personalization at Spotify, and I was and still am affiliated with Columbia University as a research scientist and postdoctoral researcher, where I studied more of neural response patterns to emotions. And now at Spotify, yes, the goal is always about how can we give listeners the music they might need in this moment without needing editors or doing this at a global scale across the world. So my team really works on the models that power a lot of these predictions. So there's kind of two that if you go on the app now, you can start typing in things like focus or calm or anxiety, and you'll get a list of editorially curated playlists, which is not what I do, or specific playlists made exactly for you based on the music we know you like with a little bit of discovery thrown in there. You can all try it. There's an anti-anxiety mix if you want. There's a calm morning mix. These are all based on this kind of newer model that we're working on now that my team owns, and it's trying to basically map descriptors of music to our entire catalog. And then from there, we specifically personalize it to you based on basically what your listening history is, what you've listened to in the past. So Spotify doesn't directly work with any sort of specific like mental health care app or any specific thing, but it kind of takes the approach that listeners know how to self-medicate with music, and as long as we can get them the music that's ideal for them or that their favorite music is, that's going to be helpful in sleep or focus. My personal take is that for most of these, the benefits of music, there's not going to be like a one-size-fits-all type piece that everybody's going to be able to allow them to focus or everyone's going to reduce their anxiety, but it's really super personalized. And so the goal here is, how can we know what a user is going to want in a given moment, or listener? Sorry, that's user is Spotify language and not person language. The other efforts that we have coming up is something called Your DJ or AI DJ. It's kind of like a AI version of a disc jockey who walks you through your music history. Right now, it's very, or kind of tells you like, hey, you know, we've noticed you've been listening to this. Right now, again, it's not geared towards, it's pretty primitive and it's not geared towards any actual goals. But what we're really trying to do is bring in much more contextual information. So where are you? We know in the mornings you typically go to the gym. So let's now surface you workout music, and that without you having to tell us that you're at the gym. We know at 4 o'clock you always try to take like a meditation or like a nap, for example. Let's try to give you that music. We're not very good at that right now, but that's the kind of goal of our team, is to use what you do typically in the context to better serve the music when you might need it.
Great. It's very interesting. So speaking of tailoring and personalizing music specifically to a goal and maybe a population, Ed, you've been working on this for a long time, as early as 2016 with the company Oscilloscape, that in 2020, it became Oscilloscape Biosciences. And basically, it provides treatments for neurodegenerative diseases using both synchronized light and music to stimulate rhythm. If you can share a little bit about the work of the company and your work, and maybe any research trials that have been done, clinical or non-clinical, about the findings. If you can unmute yourself too.
In 2020, yes, we started working on basically, you know, music-based interventions, and we targeted specifically Alzheimer's disease. So as everybody sort of knows, Alzheimer's disease is a neurodegenerative and ultimately fatal neurological disease. What we may not know is that Alzheimer's disease manifests in part as a dyssynchrony of the brain rhythms that underlie memory and cognition. So what we want to do is we want to use the power of music, which is really unmatched in terms of synchronizing brain rhythms, and we want to supplement that with pulses of synchronized light to target specific brain frequencies and even specific parts of the brain that are important in memory and cognition. So it's music plus synchronized light pulses, and we hope, you know, by doing that, we'll be able to take the power of music that, you know, some of us may have seen in short videos and so forth, to sort of awaken Alzheimer's patients and make that into a more long-lasting kind of effect, right? So we're developing a device that is really just as simple as putting on a pair of glasses. And users can choose their own music just by speaking. So they can say, play my playlist, or if they, you know, have specific songs, or perhaps a caregiver helps with choosing music. And so they're allowed to listen to their favorite music, and then there's a neural network inside. It actually runs live in real time on the glasses. So you're streaming from the web, but you're running the neural network live. And that neural network is simulating what's happening in the brain when you listen to rhythms in real time. And we use that to synchronize the lights to music. So what we want to do is we want to target basically theta, which is sort of very fast, like eighth notes in the music, and gamma, which is a little bit faster, and theta gamma coupling. And those are the rhythms that are really important in memory and cognition. So the patient can use it in their home. It's a comfortable wearable. We think it'll be effective and scalable. And it's well tolerated and doesn't interact with any pharmaceuticals. So that's important for us too. I mean, in terms of, you know, why do we think such an approach might work? There have been a number of studies out there in which, for example, gamma frequency rhythms in mice and the hippocampus of mice, which is the memory area, are synchronized with direct brain stimulation in the hippocampus. And those have shown improvements in 5XAD mice, which are genetically engineered to have Alzheimer's. There have also been transcranial alternating current stimulation of theta rhythms that have been shown to improve memory in older adults. So we're sort of piggybacking on those findings. The Li-Wei Tsai's lab at MIT has also shown that audio-visual stimulation of gamma can have some strong effects. But, you know, we see sort of a couple of challenges there. So one, you know, gamma rhythms played auditorily are sort of highly aversive. Even the mice don't like them, it turns out. And if you do visual stimulus alone, it just doesn't have the same effect. The neurons habituate very quickly, and it doesn't, just doesn't have the same effects. So what we do is we play music. So music naturally stimulates delta and gamma. That's like the rhythm of the music that you hear. And then it's also stimulating bursts of gamma activity. And that's what we try to synchronize with the lights, this theta and gamma and that phase amplitude coupling. So that's what we're trying to do. We've done, so our trials are being run in Psyche Louis' lab, Dr. Psyche Louis, the Mind Lab at Northeastern University. We did one big sort of exploratory study where we looked at younger adults, older adults, and a few adults with Alzheimer's. It was still kind of COVID times when we ran that study. And we see strong synchronization of gamma, theta, and theta gamma phase amplitude coupling. We're also able to show that synchronization to music is just as strong in older adults as it is in younger adults. And there had been some evidence to the contrary, but we used naturalistic music and we could show that the effect was as strong in older adults. And right now, Dr. Louis is running an 8-week intervention with mild cognitive impairment in Alzheimer's patients. So I can't really report those results to you here, but we hope we'll have them in the spring.
Well, that's really helpful. Thanks. And it sounds like there's a lot of really important and great work. And I think, I think the whole gamma wave excitement is building in the music as medicine space. So we'll be curious to hear how that works out for a solo. But you're right, it's not the most pleasant tone to listen to.
You want to find a way to mask it if you can, yeah.
Yeah. We have a lot of great questions coming in from our audience, but Melita, you're the music therapist in the group practicing. I know it's completely unfair of us for, to have you represent the entire field, but we're going to do it anyway. But yeah, can you tell us specifically about your work, about how you use technology, if you do, and maybe some of the reservations you might have regarding some of the ways that people think that music therapy can just be replaced by an app?
Yeah, thank you. I'm excited to be here, even though I'm the only music therapist in the group. My area of focus in music therapy is older adults. So I would do a lot with the aging population, from wellness settings to end-of-life care. I specifically really enjoy working with older adults with dementia, especially as they progress through the illness. And, a lot of just my work and learning about this population is the change that starts happening, meaning I need to change my interventions in the way I interact with the older adults. And so I end up using a lot of nonverbal communication. My guitar often is a barrier in stages when I'm working with individuals in late stage dementia. I'm finding it takes a lot longer for them to recognize that I'm in their environment, to be able to make music with me. Those things look different. And so taking my time in that space to work on engagement behaviors. And then I've done a lot of work with older adults in both intergenerational settings and lifelong learning settings. And my favorite to do in those is a lot of music learning. And we use a lot of music technology in those spaces. So I've had an iPad band before where we've worked with GarageBand and we learn how to play the instruments and we form a band and we perform. And one of the great things about doing that with it being music therapist led is that I can respond to the patients, I can respond to the clients, I can respond to the participants. So I can change so many of the music elements. We can change the genre if it's not fitting. I can change the tempo. I can change how many times we repeat it, right? And so there's a lot of me teaching the older adults how to engage with their technology, or if we take MP3 players home to learn original recordings and things like that. So I'm excited about the conversation today because I am someone who believes that technology is very useful and that it can enhance what we do in our music therapy sessions, especially when we are away from our clients. During the pandemic, we were not allowed to go into any sites here at ASU, but I still had a class that needed to work with participants, and all of our older adults were so isolated. And so just getting into a space where we could start doing a lot of virtual work, and that opened up for me the space of access. And so I'm going to slightly share about a partnership I had with Musical Instrument Museum here, where we would do these gallery visits to the museum and then half music therapy session. And it's on the north side of Phoenix, so it's usually just who can ever get there. If you have a facility, they're going to bring a bus of about 14 people. And when the pandemic happened, we were able to start doing these virtually, and just the access to the demographics of older adults that could now engage in these resources that were free simply because they no longer had to drive to the location. So I'm excited to get into more dialogue about how it looks to partner, how we get to share what we might be needing as music therapists in some of these apps that we build out and technology that we build out. So thanks.
That's great. Thank you for sharing. So as you were describing these experiences, kind of one thing that stood out to me is that human interaction. So they're going to a museum, there are people there, you're working with a therapist, there is somebody else there, and we just kind of know from neuroscience and kind of social relationship are important. So I guess I would like to pose this question to the panel, and Frank and Ed, maybe because you're working with the specific population, you can answer of what are the limitations of using an app-based technology? So you are at home, you're an elderly, you have a grandparent, and you're given a device, an iPad, or the glasses that you described, Ed. And does that have any limitation around like the person who's feeling lonely and not being able to interact via music with somebody else? And how do we address that? Whoever would like to go first.
Frank, you want to go, or?
Sure. Yeah, I'll certainly acknowledge that, you know, music is a very human activity, and it's going to be best practiced with a human involved. That sort of prefaces anything else I have to say. But there are ways of using technology to dynamically respond to the client. So, you know, we're using the camera and microphone, for example, in order to read the extent to which the participant, or we keep using different terms, client, participant, customer. So to read the extent to which they are absorbed by the music, to also get a read on what is their emotional response right now. And that's actually going to influence the next track of music that they hear. So there is something dynamic going on. And there's reinforcement learning that takes place through the use of AI. So, you know, it happens in the moment, but it also happens over time. So we can learn about the patterns, what particular emotional sequences work for a client in bringing them to their desired goal state. That's something that, you know, in some ways technology might have an advantage. But again, ultimately, I think the way to think about this is that music is a human activity. It's best done with a human. And, you know, I like this dialogue of how can these technologies complement what music therapists and other types of therapists are doing. So, you know, I'll just give you some very quick examples beyond music therapy. So currently we're looking at working with psychotherapists, audiologists, speech language pathologists, and you know they all have their own practices. But a psychotherapist might be working with a client on CBT, cognitive behavioral therapy, or mindfulness-based cognitive behavioral therapy. They'll give the client homework to do, and that homework is essential to the objectives of the therapy. Music-based digital therapy fits in very nicely. So if we can use music to create this mindful state or move towards calm on a regular basis, and the music is reinforcing, this is fantastic because it's something that people can practice every day. In audiology, tinnitus is a common reason for prescribing hearing aids. It's not just hearing loss. Again, a music-based digital therapy can support tinnitus alongside of a hearing aid. A speech-language pathologist may provide a singing intervention for a particular client, let's say post-stroke aphasia, and there's some real opportunities for supporting that practice at home in a meaningful way using a dynamic AI-based technology.
Ed, would you like to add to that?
Sure. I mean, we would like with our Synchrony Gamma technology to, be able to curate an individual user experience like Frank speaks of and Matt. But I wanted to point out, one thing that we think about a lot is how do we integrate with music therapists? So, for example, this technology that we use to synchronize the light to the music, it works in real time. So what we're going to do is we're going to put a microphone in those glasses so that when the patient does have the opportunity of working with a music therapist, they can still use our therapy to get that little supplemental benefit of synchronizing specific brain rhythms at specific frequencies. So and we've actually done some testing of this at Wartburg facility in New York. And we've worked with a number of music therapists to do this. And it seems that the patients, like it a lot. So, and, I've been in a number of music therapy sessions at this point in my journey. And I really just enjoy seeing that interaction, that human to human interaction. And we don't want to take it away. We would like to, I don't know, supplement it maybe, try to strengthen that that the effect of that music therapy without being without getting in the way too much, right?
So I want to ask a couple of the questions from our audience, but before we get there, Matt, I would love to hear your perspective, as Spotify really is, I think, largely designed to be independent of a human curator, as you were describing, even in its AI tools. So how do you think about the limitations that Spotify might be coming up against in the context of this conversation?
Yeah, it's a really good question. I definitely echo both Melita and Ed that the kind of human in the loop is really, really important. And I don't think anyone here is wanting to replace music therapy or any type of therapy for that matter. One thing, I can talk kind of generally about the social component of music listening and the benefits that usually go along with that and the efforts that Spotify is doing for that. There's jam sessions, so ways to like co-curate a playlist together, which have been around for a little. And now there's like a new version of it where you can kind of co-create a cue on a single speaker, which is, again, not so much specifically therapeutic, but more general about how I think the efforts to try to make this more of a social experience. But I think my general kind of thoughts around the kind of the human perspective of therapy would be that I think there's a real opportunity with music therapy, or just maybe therapy in general, to use music that's particularly important to a listener, or that's particularly meaningful or particularly emotional, and actively explore that with a therapist, in a room with a therapist. That's a type of music therapy I haven't actually seen done too much. And Spotify can implement that or augment that in a lot of ways. One is just, obviously, it has all the music, so it can play it. The other would be knowing what's important or what's meaningful to a user. There's nostalgia-based playlists. You can look back at your listening history for like a particular moment when you listen to something. And I think there's an opportunity for like a co-listening with a therapist where you, yeah, maybe you've already done this actually, but yeah, co-listening with a therapist based on some piece of music that's really important, actively exploring what it means to you, your feelings, your thoughts. Again, this hasn't been done, but I think it's a way in which the data that Spotify has about your listening history can help augment a type of therapy.
So Melita, are you going to be sending Matt a bunch of emails about?
I am, because I was just gonna, if I can, say how I didn't use it on Spotify because it was pre-Spotify time. But I had a patient that I was seeing in the hospital, and we were doing heartbeat recordings, and we were recording the heartbeat, and then that would become the drum beat of their favorite song that I would sing, and then I would send it to their family as a bereavement gift. And a lot of music therapists practice this in a lot of spaces. And what was really cool for this individual was that he was not from here, and we did a lot of songwriting around this around the song that was his favorite selected song. And he had served in the military in his home country, and he had traveled a lot. So after we were done with the songwriting experience, he's like, "Can you pull up a song for me?" And he started asking me to pull up all these different songs in all different languages. And I was like, wait a minute, do you know that there is an app that you can use radio stations from around the world? And so he was able to, when I kind of showed him and his wife how to use it. And Arizona is very hot, so like it was summer, you're not leaving your hospital room very much, they weren't from here. And I got the most loveliest note from the wife after the session saying, you really helped change our day around, not just for the intervention that you were there, you allowed us to transport and leave this room, because we were able to go around the country and around the world listening to radio stations and recalling music, right? And so again, if you were to then take that 10 times forward with Spotify, would be amazing. And when I used to run my intergenerational rock ensemble, yes, we would perform the music live, but there is something about older adults needing to hear the song from the 70s in its original state. And what happened is we did music from the 70s to that year. So we did Bruno Mars, we did Taylor Swift, and it also allowed them to start communicating with their adult children and their grandchildren about music preference and what they like and learning new things. And right, so if you've got a thing that's going to then give you suggestions to 5 more artists, now here's this music communication that's going on outside of the therapeutic environment that's increasing their quality of life every day. So I'm excited.
Yeah, I think that's one of the kind of maybe underappreciated values of music, is that it can serve as a starting point for a conversation and many other interactions that themselves can, be healing and helpful. So to that, in that vein, Jeff from our audience is asking specifically about people with various neurodivergences. And I know that that's a big area of work for music therapists to, help, especially people who perhaps have trouble communicating on the autism spectrum, et cetera, that, they can sort of learn and develop some of those skills through music. I don't know, Frank or Ed, are those populations something that your particular companies are thinking about targeting? Or Matt, do you want to jump in whether Spotify has like a playlist that maybe is for people who are known to have ADHD or dyslexia, and sort of how are we working through the whole neurodiversity issue?
Frank? No?
No, we are working in neurogenic and neurodegenerative diseases, but not neurodiversity. It's not on the front burner, so I'm all ears.
Right. So yeah, so the next thing coming for us is Parkinson's disease, because that also is a very rhythm a disease that's based on hypersynchrony, in this case brain rhythms, but there are many neurodivergences that are associated with differences in brain rhythms. And for example, autism is one of them. And in fact, it's not got anything to do with the company at the moment, but I did bring in a student who is interested in autism spectrum disorder and looking at music. So, it's something that may come eventually, I think. But sort of one thing at a time, I guess.
I can add a little bit of information, not so much through the Spotify lens as much as just some work I've done previously. I consulted briefly for a company that was developing music for focus, and one of the kind of using binaural beats type versions of that technology, or a version of it. And mostly the idea was to look at like focus-based tests in groups that were high or low in ADHD disorders, symptoms. So it wasn't diagnosable, but it was a very important covariate that we were looking at. And then in terms of autism spectrum disorder, again, in previous work actually at USC, and just from the research that the background research we did, we know that while emotional deficits in facial recognition might be a feature of ASD, it appears that recognizing the emotions of music doesn't seem to be as much of a deficit. So there's definitely a possibility that music and the emotional aspects of music could be used. And in general, there's some indication that autism spectrum disorder, there's a lot of musical advantages or developmental they can be quite musical as well. So there's a way to possibly use that as a way to kind of relearn these emotional deficits.
In a second, I want to get back to some of the ways in which therapist-led and music-based apps can collaborate and sort of how do we think about this in the future. But just two quick kind of practical questions from our audience members. Beth, who's a music therapist, has said that a lot of the apps that she's used or technologies have limited music libraries, which of course is a big, at least up until now, licensing music has been a big barrier to developing these libraries. And so I wonder if you can, she now uses Spotify, but I wonder if Frank or Ed, you could talk about, are these issues that you have had to come up against, or have we moved to a model where we essentially, Spotify solved that problem to some extent, in the news and through lots of controversy, but, where are we with this limited library problem?
I mean, as a small startup company, absolutely you have to deal with that. So we have to think about now already, even as we are doing our clinical trials, where's our music going to come from? Who are we going to partner with to license our music and so forth? So it's absolutely something you need to think about. And for a system like ours, we want to make all the music of the world, available to our patients. So maybe that means at some point partnering with the Spotify. We're not actually quite there yet, but we know we have to think about it. We have talked to a couple of different companies about it.
We're also exploring the legalities and commercial opportunities, but in our recent trials, we have opened up the window, and we're using really all of the music to look at the potential efficacy of the system, but the commercial and legal aspects are, in our sights, barriers for us to deal with.
Yeah, in our longitudinal studies, we actually, in one of them, we just, give the patients an Alexa, and we just sort of plug it into our device, and that, activates the synchronized lighting.
Great. So I think you're kind of like touching base on this integration and working together and how we can bring music therapy to app-based and technology-based. So I want to go back to Melinda, and since you are representing the entire field of music therapy, could you tell us, like, what are the desires of the field? Like, what is the best way that the technology environment and these the colleagues that we have here and kind of many more who are working in this place can integrate with music therapy? What is your ask, and how you can come together?
Yeah, so I think way more conversations like this, is really good. Everyone's going to have a different need for what they need their app to do. I will say for me, so I'll speak for myself and the whole community of music therapy. I'll speak for myself and say, sometimes when I'm using apps, or in technology, I am wanting something that's just grassroots. Can it play the instrument for me, right? Like, can I mimic the space of playing a piano or a guitar? When I'm getting into music listening experiences, then I want to have the flexibility of not can I just get the music, but then as a therapist, is there some homework experiences or spaces for connections that we can communicate through that app, and I can see what you're using and you can share with me. So I think some of that space of therapist user connection. So those are some of the things that I'm thinking about, is just, is it a receptive experience where the participants listening to music, are they sharing that out, or is there some sort of active engagement with the app that we want there? And I think an app that can do multiple things would be really beautiful, because we haven't been having as much success with that yet.
Yeah, maybe there's a model in which, when a therapist is using Spotify in a session, for example, they have access to elements that most users do not, because it can help them either pick the next song or use the data existing of that individual's playlist history, access that. Maybe there's a way of creating a kind of lens into some of these tools that is specific to the needs of the music therapist in the moment.
Yes, and definitely something that lends to the flexibility in the moment, so that we can change as the client is changing, would be really, really helpful.
Thank you. And I think posing the same question to like Frank and Ed and Matt, also feel free, like, what is your ask from the music therapy group and colleagues? Are you currently working with music therapists in developing your app? I know Spotify is not necessarily developing an app with the therapy, but how do you see the inclusion of the professionals in this group in the development and kind of broadening the usage of that?
We are currently working with a number of therapists in our sort of phase 1 clinical trial. In fact, our protocol involves patients working with a music therapist to develop an initial playlist that they start with. And, you know, so we also, I talk to music therapists a lot and try to get ideas and, you know, for innovative ways to use music to help people. So I think that's also really important. So, you know, some of these ideas that Melita was talking about earlier about these innovative ways to interact with people, you know, whether it's with their heartbeat or, you know, something else. I think that's, you know, that there's a lot of potential there for innovative new ideas, right? You know, we try to sort of take music and then go back to neuroscience and see if we could put the two together. But we also love to work with music therapists, and we do so all the time. Yeah.
Yeah, we're also regularly talking to music therapists, consulting with them in order to develop new ways to do this. The other type of therapy that we're just now starting to implement is that we're working with psychotherapists or people engaging in cognitive behavioral therapy. So as I was alluding to earlier, there's often homework to do in specifically mindfulness-based CBT, and it's a great target for anxiety and anxiety-related disorders. Music fits in very nicely. And so what we have are some protocolized uses of our music intervention that can be prescribed by the therapist. So that's, you know, we'll see where all that goes. We're really in a pilot phase at this point, but I'm quite optimistic about the possibility of supporting that kind of therapy with our digitally based music therapy. And I should mention that our therapy uses the binaural beats that Matt was referring to. So it's another form of entraining the brain.
Great, thank you. And Matt, I know that we talked about that Spotify doesn't have a therapeutic goal in mind, but obviously that you are working for them. You're coming from a neuroscience perspective of really valuing personality, empathy profiles, kind of cultural background of music and selection of music. So your knowledge and expertise goes into personalization of these playlists. Can you talk a little bit about that?
Sure. So yeah, as you alluded to, my kind of previous work before Spotify was a lot of trying to understand how music induces emotions and what are the factors that influence it. So one of the focuses of my research was on why certain people gain psychological benefits from things like sad music and others don't. And there appears to be, so there are tons of psychological benefits, some relating to kind of understanding a complex feeling or kind of gaining the benefits that sadness can bring without being bogged down in the usual social media that might cause it, like a death. So you can kind of gain those same benefits that come from being depressively realistic, as some people say, or some other benefits without actually being sad, and sad music can provide that. Some others are that it allows you to kind of release negative emotions or go deeper into them to purge them. And those different psychological benefits appear to be associated with different personality traits. So one is kind of more of this, as I alluded to, empathic traits of like empathy, of a specific type of empathy called like absorption or fantasy, where you become absorbed into characters or situations in movies and music. That's been linked to this enjoyment of sad music through this kind of more understanding another person and feeling connected psychological benefit. Whereas something like rumination still can gain benefits from sad music by kind of like going through and purging these negative emotions. So that's kind of the previous research. At Spotify, we're not really doing any sort of incorporation with that, though I sure would like to. And I do think these things will always need human oversight or the kind of insights from music therapy. But if we can get more of this information on a user, so one of the big pushes I'm trying to see if we can do is allow for much more user feedback or listener feedback, which we do not have at all. Mostly we're trying to guess, and rather than guess, why don't we just ask people to tell us? So this can take a variety of forms. One can be, I don't want this right now, or this is what I'm looking for right now, give me that. Another can be kind of tagging music as you're listening to it with how you're feeling. So we piloted a couple different things where like you maybe as the music is going, you can tell us how you're feeling, and then we can either give you more of that or not. But then the other would be, more in general, the question that Asal was maybe asking is, can we get a sense of other kind of demographic information about the person? So we know country, and we know, we actually don't know much more than country. A lot of that data is very, very protected, but we kind of know general location where like IP addresses could be. So is there a way to incorporate that into what we personalize for a person? So like what's trending or what's popular in your area? What are your friends listening to? Things like that. In terms of personality measures, that's also maybe something we could explore, though probably has a lot of data privacy issues and would be a little bit difficult to incorporate. But again, kind of the general approach of asking people more about what they want and who they are, we think it can really improve the way that we give music to people at the right time.
I want to get back to this kind of global nature of music and how, we need to not be US centric, since there's, of course, many other kinds of music that is listened to and used in many different ways outside of the US. But just a couple of practical questions that have come up in the chat. One question is about who is funding the clinical trials. So just if you're interested in applying for NIH funding, there is there are certain requests for proposals that are out and are coming out that could be appropriate. You can find more about those at soundhealth.ucsf.edu under funding. We do list those, and then we have partnerships with the NIH to do workshops to help people develop good proposals. But that is like, I think, a question for Ed and Frank. Who's funding the work that you're doing within these companies? Is it VC? Is it the NIH? Who's paying for the trials? And then the secondary question is, and what are you measuring? Like, what are your outcome measures then, as you're looking at the efficacy of these interventions?
So we funded our first exploratory trial was funded by the National Science Foundation. They actually have a really wonderful small business program. If anyone out there is thinking of starting a company, I would talk to them. Our current longitudinal study is being funded by NIH, and we're currently looking at applying to NIH for more money. But when we get to our pre-pivotal clinical trial, that's going to be VC funded. In fact, we're raising money for that now. So,
right, I think that's really helpful.
It's just too big. Yeah, sometimes it's just too big, of an ask for the NIH even.
Yeah, so you start with like an SBIR or an NSF kind of small business grant to get you going. You collect some pilot data that makes you competitive for an NIH grant. You get the NIH grant to collect more data, and then when you're ready to bring to market, that's when you bring in the VCs for the really big money.
Exactly.
Okay.
Yeah, it's a similar trajectory for us. We are Canada based, and so we've received a good amount of money from our equivalent of the NSF in the development of our product. In terms of the research has been supported by VCs, and for the foreseeable future, it will be a mix of VC funding and public funding.
And what about the outcomes? So given that, there are different outcomes probably for a small business grant versus what the NIH is looking for versus what the VCs are going to be watching for. So how do you measure the success of these programs?
Well, so if you're targeting a specific disease like we are, there are pretty much, standards that you have to measure, So for Alzheimer's disease, we need to measure memory and cognition. And there are, very standard ways of doing that. But we also want to measure things like hippocampal atrophy, for example. So they're imaging measures, and EEG is one of our outcome measures always. So, if you're targeting, I guess I would say if you're targeting a specific disease, you're going to want to, there will be measures that you have to use. So that's what we do. Yeah.
Yeah, we try to use the clinical standard measures. So if it's anxiety, we are using the STIXA, it's a state trait anxiety inventory. If it's agitation and dementia, it's the Cohen-Mansfield Agitation Index, or a state index of agitation. These are the gold standards that pharma trials are measured against. So we need to use the same outcomes. We are also looking at, in our more lab-based work, we're looking at EEG outcomes related and cortisol outcomes related to anxiety.
So Melita, I have a couple questions for you. One, Susan Tilbury says hello in the chat. And the other is about in regards to music therapy. One, Jess Rushing is asking, what is the most helpful or desired from technology developers? What do they need to consider from music therapists when collaborating? And I wonder actually if I'd like to ask Melita your thoughts on that first. Maybe you could talk a little bit about the kinds of outcomes that you measure as a music therapist and what you think might be helpful for tech and developers to know. And then we can ask the developer himself.
Yes. Yeah. So again, hello, Susan. That's great of the connection with Ed now. That's awesome.
I could just jump in. Susan is my current student.
She shared them in the chat. She was
sitting in the other room. Yeah.
Oh my gosh, that's awesome. That is so awesome. And she has been part of some of the projects that I've talked about with the lifelong learning. So what's really great is we have a lot of the same outcomes. And we're talking about a lot of the same measures. When we're talking about research, those are some of the same gold standards that we would be accessing. We'd be accessing the NIH toolkit and the measures out of there, whether it was patient reported or something else. So that's really a good thing that we have. I think we have a more of a common language than people probably think we do. And then especially for the partners on the team today, because you are working with a lot of music therapists, you are knowing some of that language. And then I think from us hearing what you're doing, where you're going, that helps connect to us, even if it's not music therapy. I think it sparks interest, because something I was thinking from Frank that you said earlier, when you were working with psychotherapists and CBT and giving them homework on mindfulness. Some of the early studies in music therapy in which people were using technology, especially with older adults with dementia, and giving it to caregivers in the home or paid caregivers in facilities to work on things like sleep disturbances and disruptive behaviors. Those early trials were set with just giving the technology and no music therapy oversight. And so over time, it really seemed like for family members, it just became one more thing. They really needed a little more training. They needed the therapist to be able to be with them all the time, but that's not the way the study was set up. So just being able to learn, like, okay, what are advances and things and protocols that are working for y'all that we could implement in music therapy as well when we want to give homework to patients, because homework for patients is a big thing. Something that they can be doing when they're not with us. So I think just more communication, knowing what our common language is and what y'all are doing, and help spark ideas for us on things that we could need and needs we might have.
And Matt, do you want to comment on what developers of these apps might be looking for from music therapists?
That's a really good question. A lot of what the models we build require data curators to classify music or tell us which words or tags are most representative, or editors as well. And those people have kind of like immeasurable skills. A lot of the editors, it's kind of like a vibe thing, or the data curators have kind of like know how to taxonomy things and put them in the categories. And I think the same principles could apply for music therapy. So knowing, like I've asked the editors here, actually before this conversation, we have a couple of playlists that editors make that are kind of geared towards these things like anti-anxiety or calming, or I've asked them, do you spot check this with people or music therapists or anyone? And they're like, not really. It's just kind of a vibe thing. Or, you know, like we have, I think it's called like mood lift, right? And I was like, do you actually have this lift mood in people? And they're like, no, it's like a vibe. So I do think there's like an opportunity there if they wanted, or if they really want to go in that direction, to have kind of that as another human in the loop, a music therapist, or even just like listeners tell us, is this really impacting your mood?
If I could just jump in really quick, we're currently using music therapists as our sort of curators for everybody's playlist, and to check in every week and help them pick other songs and so forth.
Yeah, I think a related question, maybe Frank, you can speak of that Brooke is asking, how often would the app take into account measuring the progress of the user? So I know that you talked a little bit about the AI-driven nature of the app, but maybe you can speak a bit more of that.
Yeah, there are regular online measures of the outcome that come from the use of the camera and the mic in our case. So again, we're reading emotion and absorption from our users, and so that's a kind of check-in. So you can imagine that over time we can get a sense of how positive or negative someone's mood is. But then we also have check-ins that we do in our clinical trials that they can be as frequent as once every session, so a before and an after. But I think in terms of a real world use, that's not the best way to go. That's just too demanding for a client. So the right kind of cadence for this is probably somewhere closer to a week to link together our dynamic measures with our more clinical measures. And then ultimately what we want to be able to do is predict those clinical measures from our online dynamic measures. And that's part of the machine learning objectives that we have.
Wonderful. Yes, one more quick question, and maybe this to Ed. Somebody's asking, were there any innovation in motor skill targeted apps? And you talked about Parkinson's and rhythm. So do you also target as one outcome development or improvement of motor skills?
We're not currently doing that, but we're currently developing our skills in Parkinson's. So the point there is to desynchronize rhythms in the beta frequency band, which is a little bit lower than gamma, but higher than theta or alpha. And we're trying to find ways that we can bring music into that process. I mean, music is already pretty good at helping people move just on its own. People have Parkinson's disease, but there are some really innovative neuroscientists out there who are finding ways to target specifically beta frequencies in those right parts of the brain, and we're trying to think if we can bring music into that process. Yeah.
And of course, there's a whole cottage industry of helping people learn to play a musical instrument that involves that kind of motor skill learning, and even other, transferring to other dexterity skills like typing and so on. So that's a conversation perhaps for another panel, as we're running short on time, and I'm gonna do my best to kind of give us a quick summary of what we've been talking about. It's really exciting to see these very specific companies that are coming up around these specific tools with particular populations of patients or clients in mind. And it's exciting to hear from Spotify that there is this, at least there is a understanding of the impact that music can have on mood. But one of the greatest benefits that Spotify has provided, I think, this space is this unlimited music library, this access to radio stations from around the world. Because we know music is highly personal. It is important that you really titrate personalize the prescription to the person. And that is what music therapy, the whole field, has been built on for 50 or 60 years. That's why we call it music therapy, where it's got this one-to-one relationship with the client and their changing needs. So I just want to say thank you, all of you, for sharing your thoughts with us. Thank you, Asal, for this idea and all of the hard work that you've done to bring us together. This panel will be archived on the Sound Health Network's YouTube channel. And we encourage you also to see some of our other resources. For example, we have a clearinghouse at soundhealth.ucsf.edu. And in preparation for this panel, we have put some of the publications from the labs of all of these individuals into the clearinghouse, so that people can get a sense of what the research is out there. And of course, we have funding opportunities. So thank you all. It's great to see you. And obviously, we have a bright future of work ahead of us.
Thanks, everyone.
Thank you, Andre. Thank you, Asal.
Thank you all.
Thank you.
Thank you.